good evening to you all, and thank you for your presentations. I suppose when we talk about deprivation of liberty, we kind of instantly think of prison. So I suppose to just address that first, we've had the Irish Prison Service in here before, and they identified the fact that there were a large number of people in our prisons with mental health issues, with autism, with intellectual disabilities, and again, it's not quantified, and they're not able to deal with it. I mean, they do their best. I've talked to people within the prison service, but there are shortages in the staff that they need, you know, psychology and psychiatry and so forth as well, to try and help the people. But, I mean, the point I would have made there, and they would have agreed, is that if the supports existed in the community, these people would not be in our prison system, and that's not the place they should be in whatsoever. But we could talk then, as you have mentioned there, deprivation of liberty isn't just about people being in prison, it's about people being put in residential or in psychiatric wards within hospitals without their consent. And again, and I've come across cases as well where some people have gone into requested psychiatric care, but the hospital is trying to discharge them before they're ready, and we have that issue as well. And there's a lack of housing, there's lack of supports, mental health supports, disability supports in our community. So we nearly need to take a helicopter view, because then when we look at it, we don't have the staff for our disability teams or for our mental health teams on the ground. Why do we not have the staff? Part of it is housing. Part of them is that they're going abroad because they can't afford to live here, and then those that are left here can't cope with the demand on their services. So there's going to, I mean, we're open to suggestions, but there's a huge amount of planning needed to take a much bigger view of everything, because everything's interconnected. So I suppose it's just to, I suppose, just where do we start? I suppose that would be the point. Where do you start to address this? Because it's got so bad. Our prisons are overcrowded, as you have identified, Professor, but then there's so many people that should not be in there. So, and I would even make the point that if supports were put into communities that have been deprived over generations, where there's an intergenerational unemployment and lack of supports, that if the supports were put into those families, you could avoid a lot of expenditure at the other end, where people end up in prison because they haven't got the supports. So I suppose to say, where would you start? I know you've mentioned the lack of legislation in this area. I'm also aware that I think the state will be in front of the UN committee, I think, next year as well, and I think they're going to be very critical of the lack of legislation in this area, the fact that there isn't proper legislation for dealing with so many of our issues, even recognising that mental health is a disability and that it needs to be treated in that way, and comes under the UNCRPD as well. And even just on the Assisted Decision Making Act, it was remarked here recently as well that the wardship has ended. It was 3 years, I think, for people to come out of wardship, but yet the response on that has been very, very slow as well. And again, it's because maybe the options for people aren't there, or the cost is prohibitive, or people just don't know enough about the procedures. So there's a lot of issues, but I suppose it's where to start to address them. So, thank you.
I would start with the amendment and the ongoing drafting of the mental health bill. That would be my starting point. Adam, do you want to?
Yeah, I would agree with Rosalie, and I think what we've seen is significant delays in legislation across the boards, whether we're talking about in terms of adult safeguarding, and whether we're talking about inspections of places of detention, whether we're talking about Deprivation of Liberty legislation. There's very unclear timelines in relation to these various pieces of legislation, but also there really needs to be significant care in how each of these pieces of legislation interact with each other, so that we don't, I suppose, treat one category of people with disabilities different to another, as is the case for those with psychosocial disabilities at present. I think what is critical, across everything that we're saying on this issue, is that the starting point has to be to listen. Obviously, that is the central thread that runs through the UNCRPD. And I think even when we've looked at, for example, the assisted decision-making legislation that we have in place, I know concern that would have been raised at the time was there wasn't enough time put in place to hear the voices of DPOs and those who are going to be most affected by the legislation. So I think while we need to move at pace, we can't afford to make that mistake once once again. And I also just wanted to build on one point that you made, which I thought was very important in terms of widening our understanding of what we mean by deprivation of liberty. You know, I think we saw examples of this during the pandemic, for example, where, you know, key passes were installed in places like nursing homes without residents' consent, without residents being given that same support. We see it within our school system, where there's still a complete dearth of regulation around seclusion and restraint, probably actually an area in which people have the least rights of any setting within Ireland. So I think we very much need to broaden our understanding, and I draw your attention to the recommendations IREC made in terms of the submission on the general scheme of the inspection of places of detention bill in 2022, because one of the recommendations that we're making is a real need to broaden the range of settings in which that legislation would apply to include places like healthcare and residential settings, voluntary organisations offering addiction services, state procured services, and so on. And also that the state must strengthen the procedural safeguards governing involuntary admission in line with international human rights law as well.
I guess just to, you know, before I can make a concrete recommendation based on my experience on the ground, it's just worth saying that the vast majority of mental health care in prisons is done on a voluntary basis. In fact, it's always done. You cannot use involuntary treatment in prisons with consent, and it's based on the same principles as in the community, essentially principles of choice. Legislation is actually used very sparingly. In 2016-2017, I was working in a different prison in the west of the country, and what I did was I looked at the numbers of people passing through the prison gates, how many people actually need to see a psychiatrist, and how many people are so unwell that you actually need to use legislation. And there was about 1,500 people that passed the gates of the prison in a given time period. About 123 required secondary or tertiary psychiatric care, and only in 11 instances was legislation required for diversion. So it's worth making the point that it's not, the majority of case is voluntary, a majority of care is voluntary, sorry. Where I can see a good starting point for if we had to break the cycle where people are unwell and they leave prison and they end up back in prison, if we were going to break the cycle, there's one point which would be a point of great impact, which would be housing. If there's one challenge I see, on a week-to-week basis as a clinician is if someone leaves without an address, if they don't have an address or they don't know where they're going, you can't link in with a general practitioner. Then there's the issue of which pharmacy you get your medication from, which psychologist you refer to in the community, which community social worker is going to be involved. So that address is critical. What really works is the housing first. I think that's one of the most progressive initiatives in Ireland. But if the community could do something to improve access to housing first for those leaving prison, that would be a concrete recommendation from my side, because I've seen it work. It's based on the principle of affordable housing. It's based on the principle of choice. It's based on wraparound supports, not just mental health care, psychological, social, addiction supports. But if that can be strengthened, I'd say we'd be able to break the cycle that we're seeing.